Hello and welcome. My name is Casey Setsodi. I'm with Health Partners UnityPoint Health, and I'll be guiding you through our sales presentation today, talking about the plans that are available through Health Partners and UnityPoint Health. Now, after I introduce Health Partners UnityPoint Health and explain some background on Medicare, we'll spend most of today looking at your plan options. While we go through today's presentation, I will address the questions that you currently see on the slide. So let's start by talking about Health Partners UnityPoint Health. At Health Partners UnityPoint Health, we're going to work together to make the best decisions for your health with both care and cost in mind. And here's how we're going to do that. Through personalized care, a partnership between our doctors and insurance team is going to mean better, more affordable health outcomes for you. A single team getting your health care and insurance coverage from one place makes managing your health simple. Track record you can trust. Health Partners UnityPoint Health is a partnership between two organizations with a history of great results. And UnityPoint Health, as you know, is an Iowa nonprofit organization providing services to hospitals and healthcare providers, integrating healthcare services to patients across Iowa and into West Central Illinois and Southern Wisconsin. You might not be as familiar with Health Partners. Health Partners is a Minnesota-based nonprofit organization that serves more than 1.8 million medical and dental health plan members nationwide. Health Partners is more than just an insurance company, however. The Health Partners hospitals, clinics, and other healthcare facilities care for more than 1.2 million patients every year. So Health Partners does know the importance of having your care and insurance coverage work together. So the Health Partners UnityPoint Health is a health plan centered on you. It's the result of two organizations that want to achieve the same thing. It brings together healthcare from UnityPoint Health and insurance from Health Partners. The result is a company that's dedicated to keeping our patients and members healthy. And we're doing it while providing a simplified healthcare experience. Now let's jump into some background about Medicare. Medicare is divided into different parts: A, B, C, and D. Original Medicare, which parts A and B, is health insurance for people 65 or older, anyone with certain disabilities, and people with end-stage renal disease or permanent kidney failure requiring dialysis or a kidney transplant. And please note the rates that you see on your screen currently may change in 2021, and we will certainly update the numbers once the 2021 figures have come out. So Part A is your hospital insurance, which you'll see over here on the left. You pay this amount for each benefit period. The Part A deductible for hospital is $1,480. And it starts the day that you're admitted in a hospital or skilled nursing facility. And it ends when you haven't received inpatient hospital care or skilled care for 60 days in a row. You have to pay the deductible for each benefit period. And you do have unlimited benefit period. After you pay this deductible, you'll pay a copay or co-insurance for covered services. Part B, which you'll see from the arrow I'm moving on the screen. For 2020, the Part B deductible is $198. And most people will pay $144.60 for the Part B premium. These premiums are calculated on a sliding scale based on your adjusted gross income, which means that you may pay more for your Medicare Part B if your adjusted gross income is above a certain amount, currently $87,000 for individuals and $174,000 for people that file jointly. You'll pay a coinsurance, usually 20%, for covered services like the ones listed on the screen. It's important that you sign up for Part B when you're first eligible. Otherwise, you may have to pay a late enrollment penalty for as long as you have Part B. I'll talk about those enrollment periods for Medicare in a little bit. You do have a lot of options for how to get Medicare coverage. You can choose original Medicare coverage only, or choose original Medicare and enroll in a standalone Medicare prescription drug plan. You'll see on the right part of your screen there. However, many people choose to join a private care health plan known as Medicare Part C or the Medigap Supplement Plan. And then most of these are also paired with or include a Part D plan. So why Medicare Advantage plans? Here are some of the reasons why people choose a Medicare Advantage plan. First is savings and predictability. Medicare Advantage plans usually have lower or $0 monthly premiums compared to supplement plans, which may cost anywhere from $150 to $200 a month, depending on your age and area, which doesn't include Part D prescription. And beneficiaries will be able to budget for their healthcare costs by understanding the copays and coinsurance. The second reason will be simplicity. With a Medicare Advantage plan from HealthPartners UnityPoint Health, your hospital, medical, prescription drug, and preventive dental are combined into one simple plan. And then third are the extra perks. The HealthPartners UnityPoint Health Medicare plans provide extra benefits and perks not offered by original Medicare or many supplement plans, to include travel benefits, a fitness benefit, health and well-being programs, dental benefit, and vision and hearing benefit, plus personalized support, which we'll get into the details of that shortly. Now, Medicare Part D is very important to understand. Part D is available to everyone with Parts A and or B. It's not offered through the government like Parts A and B are, which means you'll buy it through a private insurance plan. You can only be enrolled in one Part D plan at a time. Just like with Part B, it's important to enroll in Part D as soon as you're eligible, or have coverage that's at least as good as Medicare Part D, known as credible coverage. Otherwise, you may have to pay a late enrollment penalty as long as you have Part D. However, with the HealthPartners UnityPoint Health Medicare plan, your Part D prescription drug coverage is included in your plan. So here's how Part D works. You move through 4 Part D phases throughout your plan year. Not everyone goes through all the phases, but there are 4 phases. So at the beginning of each plan year, for example, this upcoming January 1st, you start at the deductible phase. You're going to pay 100% of the cost for your prescriptions until you reach your deductible, if you happen to have one. Once you reach that deductible, then you're going to move into phase 2 that they call the initial coverage phase. Here, you either pay a copay or co-insurance for covered medicines. Now, most people spend the majority of their plan year in this phase. If you and your plan combined pay a certain amount for covered medicines, you enter the coverage gap, used to be known as the donut hole. So for example, For 2021, that amount is $4,130. And of course, this may change each year. So if you, along with your insurance company, pay an amount greater than $4,130, which is tracking the total cost of your medications that are filled, you move into phase 3, where you will see, then you will pay 25% of the cost of your generic drugs and 25% of the cost of your prescription brand name drugs. Then as they continue to track your out-of-pocket costs you're paying during the year, if those total costs exceed $6,550, you will move out of phase 3 and into the final phase, phase 4, that they call catastrophic coverage. Then you will pay the cost that you see on your screen there. As a reminder, everyone starts in the deductible phase at the beginning of each plan year, which is January 1st. Regardless of how much money you've spent the previous calendar year, or perhaps you're new to Medicare and you just started your Part D, say in October, it will reset January 1st. Now, Extra Help is a Medicare program to help people with limited income and resources pay Medicare prescription drug costs. You may qualify for Extra Help if your yearly income and resources are below a certain amount. You can contact your local Social Security office to see if you qualify for this program. To sign up for Original Medicare, there are certain times when you can do that. You will have your initial enrollment period because you're turning 65. At that time, that enrollment period will begin 3 months before you turn 65 and last until 3 months after the month that you turn 65. So that initial enrollment period will last a full 7 months. They do have special election periods. For example, if you didn't sign up for Part A and or B when you were first eligible, because maybe you were covered under your employer or a spouse's plan, you can sign up then for Original Medicare during the special enrollment period. For example, you're leaving spouse's plan or your group plan because perhaps you have retired. If you're getting Social Security benefits or from the Railroad Retirement Board, you will automatically be enrolled in Original Medicare when you turn 65, unless you contact them, tell them differently. Now, these are the most common enrollment periods, but there are many others. For example, if you move out of state to a new area, would be another enrollment period. There are several special enrollment periods. So if you check out your Medicare and You handbook or visit medicare.gov, medicare.gov, you can view all of those special election periods. Here are some other helpful resources for you as you're shopping around to look at plans, whether it's during the annual election period, maybe you're already on a Medicare Advantage plan or a Medicare supplement, and you're looking to make a change for potentially various reasons, lots of various reasons. You can go to our website, which you will see on there on your screen, oneplanforme.com, or visit the Medicare website, medicare.gov, to look at the plans that are available in your area. One of the things that I address right away with respect to questions is one that I get asked all the time. And that is, how does a company offer a healthcare plan with a $0 premium? So I'd like to just address that right away before we actually talk about specific plans, because it is the most common question that I get. So to answer that, first, remember, you're still paying your Part B premium to the federal Medicare program, regardless of whether you sign up for a Medicare supplement and a Part D plan separately, or if you decide to join a Medicare Advantage plan, which is Medicare Part C, you continue to pay your Part B premium. The federal Medicare program pays your Medicare Advantage plan a fixed amount each month to cover the cost of your health care. And second, plans use carefully chosen networks to offer high quality care at a lower cost. And third, plans with $0 premiums really focus on making sure you get the right preventive care, because obviously, if you think about it, a healthier you means lower healthcare costs, not only for you, but for the company as well. So let's talk about the two plans that are available to HealthPartners UnityPoint Health. And right before we do that, we're going to talk about something that's very important as you're out there looking around to compare plans, and that is the CMS or Medicare star rating. Every year, CMS measures how well Medicare health plans perform. And the scale that's used is known as the star rating system. Ratings range from 1 to 5 stars, with 5 being the highest score a plan can get, 1 being the lowest. And you can see a plan star rating in the particular plan materials, their website, as well as the Medicare website that I gave you earlier, medicare.gov. And we're very happy that for 2021, both of our plans Align and Symmetry received a 4.5 out of a 5-star rating. When you go to medicare.gov, you can filter your search by star ratings. If you don't want to see every plan, which would include lower star plans, you can choose to filter by either 4-star and above or 4.5 and above. That way you're only focused on the highest rated plans. So here they are about the plans. We have 2 Medicare Advantage plans that you can choose from: Line and Symmetry. Both plans are what you call PPO plans, or Preferred Provider Organization. What this is going to mean is, as a member, you will have what they refer to as in-network coverage, but you will also have out-network coverage if you so choose. The network for our plan, of course, includes the entire UnityPoint health system, wherever those facilities may be, and then anyone that has contracted to be an in-network provider. For example, you will see some names on the screen there: Avera Health, Sanford Health, University of Iowa Healthcare, Iowa Clinic, Farland Clinic, and more. If you would like to see the full network or search, we recommend that you go to our website, oneplanforme.com, find DR21. So it's that's the word one plan for me, / find DR21. The HealthPartner UnityPoint Health Service Area is going to include the following counties in Iowa and Illinois that you will see. To be eligible To become a member of one of the plans, it's very simple. You just need to have Medicare Part A and B effective and live in one of those counties that you see on your screen. Just to reiterate, this is just to become a member. Some of the medical facilities that are in-network providers may be in other counties that you do not see on the screen, which is fine. Medicare defines this service area as the counties that you just need to live in to be eligible to enroll in the plan. And there are no pre-existing conditions, no health conditions. As we look at some of the plan specifics, you will see on your screen here the two names that I mentioned, Align, Symmetry, and in the upper left-hand side, see that website that I talked about to be able to check on my doctors, oneforme.com, find DR21. This is a partial view of the benefits that are available. We recommend that you, if you want more information, you can find it online at oneplanforme.com, or you can call us with the contact information that I'll show at the end of the presentation. And make sure, whether you do it online or if you call, you'll want to request a summary of benefits, which will then give you the full detail of everything that is covered and what associated costs may be. You can see that the Align plan has a $0 premium. Symmetry plan is a $39 premium, which would be in addition to your Part B premium. You can see that the out-of-pocket maximums for the two plans are $3,900 and $3,600, respectively. That number is just the most a member might pay for services in that given year through any combination of the different co-pays and co-insurances. And also you'll notice the $5,100 located on Symmetry. That is the out-of-pocket maximum combined for in and out of network, which you'll see is $6,500 on the Align plan. So we heard time and time again about members be choosing a different plan from one of ours just because of one specialist that was maybe out of network. So you're going to see for 2021 that we have set co-pays for these out-of-network visits that will help a person get a true estimate for annual cost a member could expect. And note that primary care and preventive services are a $0 copay in network for both plans. And again, this is just a quick snapshot of the plan highlights. You'll want to go to our website, theoneplanforme.com, or give us a call to obtain a summary of benefits that will detail out plan coverages. Your Part D is included in either the Align or Symmetry plan. It's all combined. And you'll see on the left-hand side of your screen, if you recall the slide when I covered the 4 different phases of Part D, we have placed those 4 phases on the left: deductible, initial coverage, coverage gap, and catastrophic phases. And then the corresponding cost of your medications are on the right-hand side. So that deductible phase, you will see that you actually do not have a deductible with either one of our plans. So you have coverage for your drugs immediately. There's nothing that you have to pay at 100% out of your pocket. The initial coverage phase, you will see tiers 1 and 2 are the generic drugs. If you choose to go to a retail pharmacy, your 30-day cost would either be $2 or $9 for a 30-day supply. If you choose to use mail order, you would pay a $0 cost for a 90-day supply. You'll see that's the same on both plans. And there is no shipping charge. So it's $0 for any generic medications on those first two tiers. Then you will see the brand name drugs at $47. You also will get a discount for mail order. And you'll see that we participate in the Select Insulin program, where you're going to pay $35 for a 30-day supply of Select Insulin in each of the Part D phases. So regardless, if you go into the coverage gap, you will not pay 25% of the cost for your insulin. You will continue to pay just $35. And you will also see that you'll get a discount on that if you choose to get that via mail order. Another important aspect of using mail order is for people that go into the coverage gap or phase 3. This will slow down the time for you reaching that phase because, as a general rule, the total cost of mail order prescriptions are less than retail. And remember, that's the number that they use during 2 to track towards that $4,130 of total drug cost that you have in the calendar year. And as we move down, you'll see during the coverage gap on the aligned plan, your generic drugs will be 25%. If you go retail, brand name drugs, 25%. Your select insulins stay at $35. On the symmetry plan, you will continue to pay the $2 or the $9 or $0 if you're doing mail order, even though you are in the coverage gap where you'll pay 25% normally. And of course, the insulin is at $35. And then there you'll see the cost if you reach phase 4. So please check out our website, oneplanforme.com, or call us using the contact information that I'm going to provide. If you would like to see the list of the insulins that are covered under the Select Insulin program. You'll also see the sites to visit on your screen if you want to check your medications to see what tier they would be on for your HealthPartners UnityPoint health plan. It's the oneplanforme.com/checkmeds21. And if you remember, there were the main reasons that people chose to look at Medicare Advantage was the simplicity. All right, everything is in one plan. You have one card. People are able to budget knowing the co-pays. As I go back here to the medical benefits, you'll see, for example, the Aligned plan. There is no additional premium you're going to pay on top of your Part B premium. When you see your primary doctor, you're not going to have a copay to see your primary doctor, no matter how many times during the year you may have to visit. All your preventive care is going to be at $0. Your drugs included in the plan, your drug coverage. And then you throw on top of that the extra benefits and perks that will come with it that are not covered through original Medicare, which is what we're going to talk about next. You'll see here personal support, fitness, dental, online care, travel coverage, Assist America, Eyewear hearing aids, and a great website. Manage your account online, see claims, pay bills. So let's go through these. First, you're going to have personal support. In that will be member services for questions about your plan benefits, account balance, or finding a doctor in your network if you want to make a quick call. The feedback that I have gotten for a long time, people really like our personal support, especially the member services, because it is more of a local feel. We are a regional company. Our customer service is located right in Bloomington, Minnesota, staffed by our own employees. We do not farm out any of our customer service, so you're always talking to someone from HealthPartners UnityPoint Health. There'll be a care line and a nurse navigator program. Our care line service is staffed by registered nurses that are employees and have been trained by HealthPartners UnityPoint Health. You'll find out if maybe you should see a doctor or just ask questions about medicine you're taking, learn about home treatment options, things like that. In our nurse navigator program, you might have questions about your health care and benefits. Maybe you would like to discuss or need help choosing a treatment option. And then we have behavioral health navigators. If there's a need to find a mental or chemical health professional in our network in your area. Very important to exercise and stay healthy. You'll be able to do that whenever you want, either at a facility or in your home with our Silver and Fit Healthy Aging and Exercise program. So you'll have a gym membership. Any in-network facility at no cost to you. You'll see a website right there, silverandfit.com. Simply go there. You'll put in a zip code in that search function, and it's going to pull up all the facilities that are going to be considered as in-network. If you go to one of those facilities, we are going to pay your monthly membership. You still can access an out-of-network fitness center if you would like. If you choose to go to a facility that's not in network, we'll pay 50% of the monthly membership for you. That way you're still able to participate and get this benefit. Plus, you get the home fitness options. There are 34 home fitness kits available to you. The main categories are cardio and strength, yoga, chair exercises, stress management. You'll get 2 of those kits free per year. That includes all the materials that are needed, DVDs, guides, other fitness items, etc. Along with that, you can choose between one of five Stay Fit kits, which is going to include a free Fitbit or Garmin. So we have an incredible fitness program for you to utilize as a new member. Something that's been important for the year of 2020 is how am I able to receive medical care, maybe not having a face-to-face experience with my doctor. We have that covered with our program called Virtual, where you're going to have unlimited visits at no cost. Virtual is just like a doctor's visit, but it's online and it's easy. So if you feel like you might be technically challenged, that's okay, because you're not going to have the need to work any complicated video apps or download any application, etc. It's web-based, and it's a very convenient 24/7 online clinic where you can get for several conditions, basic things, sinus infection, ear infection, and again, it's a $0 copay. I encourage you to go to that virtuel.com because the list of things that they will help cover continues to grow. And currently, right now, it's available only in Iowa. Very important benefit. Everybody wants to know, do you have dental benefit? And we do. So you will be paid up to $1,000 per year for preventive and diagnostic services, cleanings, exams, x-rays, fillings, simple tooth extractions, surgical periodontics, as an example, as long as major dental, such as surgical periodontics, oral surgeries, crowns, onlays, and prosthetics are covered at 50%. Very simple to use. It just works off of simple reimbursement. There's no network that you need to worry about. You can see any dental provider. You turn in your receipts, and then you're reimbursed throughout the year up to $1,000. Travel coverage. We get lots of questions on how a person is covered under a Medicare Advantage plan when they're traveling. So here we'll talk about Medicare first. Medicare requires any Medicare Advantage plan to cover their members at the in-network cost for emergencies and urgent care, regardless of where they are worldwide. So for example, on our screen with our medical benefits, you saw that our emergency room visit was $90. That's the in-network cost. So regardless of where you would have your emergency, anywhere in the world, your end cost $90. So that's a Medicare rule. Then we add more benefits on top of that with our travel coverage in Assist America. So first, we have something called the Visitor Traveler. Here, a person will be able to get up to 9 months of in-network coverage anywhere within the United States. There's no additional cost to have this program. Call and activate it. As long as you're going to be away from home in 30 days, then you can visit any Medicare provider for non-emergency and non-urgent care. Because remember, again, you're always covered for emergencies and urgent care at the in-network cost, regardless of when that's taking place. But if you know you're going to be gone more than 30 days, you'll have a visitor traveler benefit to let you get in-network care that's non-emergency. It's a wonderful benefit, and it's very simple. It's just any willing Medicare provider. It's not tied to any type of network. We also provide logistical help. You'll see the website there on your screen. I encourage you to visit that, assistamerica.com. That's assistamerica.com. And how that program will work, it's automatically activated once you're more than 100 miles away from home. So anything that happens unexpectedly, you're going to have Assist America at any time on your side at no additional cost. They provide worldwide emergency travel logistics during the first 90 consecutive days that you're away from home worldwide. You'll always have someone experienced on the phone that will help you in assessing your need for medical care and to coordinate post-stabilization transportation to the nearest medical facility or home. This can be a very nice feature to have if you're traveling overseas, where every country's medical system can be a little different, and you may need interpreters. So I encourage you to go to assistamerica.com to check that out. And then there's eyewear and hearing, another very common question that we get. We do have coverage for you for both of those. Eyewear, the plan is going to pay up to $100 for any non-Medicare covered eyewear. That's going to be contacts, frames, lenses, things of that nature. And again, our benefits are very simple to use. There's no network. You can go to any optical provider. There's a reimbursement form that you can download off of the website. Once you become a member, you send it. It's very quick, easy, basic information, and sign it. Send it in with a receipt. We will mail you a check for $100. Hearing aids, if it's needed, incredible hearing aid benefit. You'll see the two numbers on your screen there. That is the copay per hearing aid, which you can do 2 per year, 1 per ear. That copay is based on the technology level. And again, as I have said more than once already, very simple program to use. As a member, you'll have a dedicated phone number to call into to speak with the representative that will then even three-way call you into a local provider to schedule an in-person appointment for your hearing test, help you determine which technology level is needed. You make co-payments, accordingly. And then your hearing aids come in, and the benefit also includes the follow-up appointments as they fine-tune those hearing aids to work the best for you. You can look at more details at hearing.com. You'll see that on the screen. So we've talked about a couple great plans as options for you as a Medicare beneficiary. So as we finish here, let's talk about what the next steps are. You either need to enroll in Medicare Part A and B, or maybe you already have, in which case then you decide which HealthPartners UnityPoint health plan is for you. Go to our website, oneplanforme.com. You can talk to a broker. You can call the 800 number that you see on your screen. You can send an email that you'll see on your screen there as well. And we recommend you do to get a copy of that summary of benefits. If you decide that you want to join one of our plans, we make it very simple to do that. If you go to oneplanforme.com/compare21, that website there, you can do it yourself online, get immediate verification that's been completed, or you can call the 888 number that you see on your screen. If you would like to talk with a local broker, either via a phone appointment or in person, you can reach out to let us know that, and we're happy to get you set up with someone locally to talk to. After you have enrolled, what you can expect is to get a welcome packet in the mail, a member ID card, where to find your coverage document, along with some other helpful material. And then you'll create your online My Health Partners account. And always remember to schedule that preventive welcome to Medicare visit or your annual wellness visit. Just try to stay on top of your health. Here's the contact information I referenced throughout our presentation today. So there's the 888 number. If you would like more information, please call that number. Or there is our website, oneplanforme.com/compare21. Thank you so much for watching today. I hope it's been very helpful and that you have decided you feel one of our plans will work for you.